What are the causes of dyslexia? Dyslexia tends to run in families. If you or a family member has dyslexia, there is a chance your child will too, though it's far from certain. In addition to having a family history of dyslexia, people who were born prematurely or with a low birth weight have a higher risk of developing it. While in the womb, exposure to alcohol, drugs, or illness can all increase the risk. Some of the causes of dyslexia are dyslexia or other learning difficulties in the family, low birth weight or premature birth, nicotine, drugs, alcohol, or virus exposure during pregnancy may affect the fetus brain development. Individual distinctions in the areas of the brain that allow you to read. It's caused by a genetic mutation, which is why it commonly runs in families. If your parents, siblings, or other family members have dyslexia, you are more likely to have it as well. Dyslexia is equivalent to any other mental aptitude or ability, despite the fact that it has a genetic component or weakness. A child's susceptibility to acquiring dyslexia may or may not be inherited from her parents. Even if the child inherits the genetic susceptibility for dyslexia, the child may not suffer the typical dyslexia symptoms. Occasionally, this is simply childhood dyslexia that isn't recognized until much later. However, the same symptoms can appear as a result of a brain injury or dementia. Complications. Dyslexia can lead to a number of problems, including trouble learning, because reading is a skill basic to most other school subjects. A child with dyslexia is at disadvantage in most classes and may have trouble keeping up with peers. Social problems. Left untreated, dyslexia may lead to low self-esteem, behavior problems, anxiety, aggression, and withdrawal from friends, parents, and teachers. Problems as adults. The inability to read and comprehend can prevent a child from reaching his or her potential as the child grows up. This can have long-term educational, social, and economic consequences.